and through Bible study. But I think we can tackle this thing in a number of different ways.
Yes. Oh, yes.
So we're definitely honored and appreciative that you would jump on again just to share your insight. Listen, I'm a man of faith. So do you mind if I go ahead? I want to open up with a word of prayer. I know that you're a woman of prayer as well, woman of faith. So I want to just go ahead and open up with prayer, and then we can dive right into our topics. Now we do, there are a number of topics that we'll discuss. By all means, if there's anything you want to add to that, what we're going to do, I'm a sports fan, so I'm going to lob it up and I'm going to let you knock it down. anything you want to add to that, by all means, you have the freedom to do. Okay. All right, let's pray. Father, I just thank you for this moment. I thank you for this time, this opportunity, God, this special time, this special occasion for us to come together, for us to receive insight, God. If we can have an ear doctor, if we can have an eye doctor, God, if we can have a nose and throat doctor, surely we can speak to someone that has expertise concerning what's going on in our mental focus and capacities, God. I thank you for what's going to be said here, and we believe that it's going to be impactful and relevant in this season. In Jesus' name we pray. Amen. Amen. So without further ado, again, thank you again so much. I can't thank you enough for you taking the time. I recognize that you're busy. You have your own family and children. I know my brother was just there, and he's not there anymore. But what's up, Melvin? If you hear this, I'm sure he hears me. So I'm going to, this is really just a time and opportunity for you just to share with us your thoughts and your expertise. This is a very critical time. It's a very anxious time. This is a time where there's a lot of uncertainty. So again, we're grateful for you and you walking us through this. All right. So without further ado, I'll go ahead and there's a lot of acronyms here. My wife was telling me about these acronyms. Okay, I'm Pastor Jay for everyone. Thank you, sweetheart. I'm Pastor James. This is my wife, Lady Shalonda Driver, and we are with Tarsha Wiggins. We're going to allow her to introduce herself and very briefly just share with us her expertise concerning this matter, and then we'll jump right into the topic of what we want to discuss. Okay, so without further ado, Mrs. Tarsha Wiggins, please take away. Just tell us a little bit about yourself.
Oh, absolutely. Thanks so much for having me, everyone. Yes, my name is Tarsha Wiggins. I'm a licensed clinical social worker and certified alcohol and drug counselor. I have 10 plus years of working in this field. I wear my proudest badge as being I started off as a child protective social worker, and I honestly thought, I'm working too hard for this little check. I got to go back to school. I got to make some more money. I'm doing everything. Right. So from there, I went back. I got my master's degree in social work. I emphasized my concentration in mental health. Partway through that, I decided, there's a lot of correlation. I'm always thinking about what's next, bigger, better, be the most impacted employee. So I decided to add on an addiction certification to my education course as well. Since that time, I have been blessed. I have worked in every level of care when it comes to behavioral health services. So that includes an outpatient setting where you can do one-on-one work. That also includes residential treatment where you go, you stay 30, 60, 90 days, as well as some of the step-down programs, which entails partial hospitalization. That means you partially out the hospital, where you come, it's like working a full-time job, working on yourself 5 days a week, 8 hours a day. And I've also had the opportunity to work in that IOP, or intensive outpatient setting, where you get to go home, work on yourself part-time through the day, and then eventually stepping down to just working one-to-one once or twice a week. So that's kind of a little bit about me and what qualifies me to even talk about some of this stuff today.
Awesome. I think it's important for us to just share with our audience. We just not talking to anybody. This is not barbershop talk. This is not no. We do in the barbershop or the hair salons or the nail salons. This is someone we believe that you are someone we definitely believe has insight, and the expertise, and the knowledge behind what we're discussing tonight. So again, thank you for that. So we'll get right into the questions. I have a number of questions that I wanted to ask you for my own knowledge, and then obviously to share with the viewers and the listeners and those that are joining on with us. There might be, my wife is actually, she's in a dual role. She's here with me, and to work with you, but then also she's going to act as a moderator as well. So if there are any questions that come up in the comments, my wife is going to, Lady Shalonda is going to share those with us and give you an opportunity to kind of talk through those. So again, you've been very helpful and we appreciate that. All right,
Awesome.
So without further ado, let's jump right into question number one. All right.
Okay.
All right. So there's a lot of fear and anxiety regarding COVID-19. All right.
Yeah.
So what advice would you give us to help navigate through these uncertain times?
That's a really great question. All right. So how do we navigate through these troubled times? I think the first thing that we have to do is, one, be mindful of the anxiety, or maybe it's not even anxiety. Maybe you are experiencing a bout of depression. Sometimes those two things, the symptomology of both of those things can look similar. So real brief, and I know, we got a couple of things we want to get through and leave time for other questions. So when we talk about anxiety, what is anxiety? What does that look like? On all my work, and my mom is a Southern lady, and she'll talk real nice and cuss you out and then pray for you all at the end. But she always say, maybe, right. She always say, make it plain, baby, make it plain. So, taking something that can be a little complex and really just trying to make it simple and understandable. Anxiety overall is that feeling where you feel closed in, you have this anxiousness. The best way to describe it physiologically, or that what you feel in your body, is that thing in your stomach that gets bigger and bigger and bigger, where it's consuming you. Everything you think about, your thoughts, your emotions is consumed with that source of anxiety. So a lot of times what that looks like in individuals, or the symptomology behind it, is you're irritable, maybe you're having sleep disturbances, you have this like gloom and gloom feeling, or that like excessive worry, like, well, what about this? What about that? Well, COVID this, COVID that, So those are some of the classic symptoms surrounding generalized anxiety. Some people have an onset where they have panic disorder in association with anxiety. So overall, if we're talking about just anxiety itself, what things are those triggers, or how can we navigate these waters? Is first, you got to see if you have it. Are you having these symptoms? And it's not so much, oh, today I felt this way, but is it persistent? Is this feeling or these emotions lingering? Are they becoming more intensive for you to manage? Maybe they're waking you at night. Maybe you sleeping all day as an avoidance to experiencing your emotional response to this situation we're in. And, so we have to be a good gauge and be honest with ourselves. Like, and when people ask you, are you doing okay, or how you're doing? If you're being honest with yourself and you're doing that inventory, like, I'm really not sleeping. I'm eating everything in sight. I ain't hungry. I'm short with people. I feel so restless. I feel fatigued. I feel just defeated. Those are the things, the warning signs that we want people to be aware of. And it's not just saying, oh, you're crazy, or, you're just having a rough time and I just need to deal with this on my own. People may experience anxiety one day and feel really down or heavy about things. And the next day or later that day, you can be feeling upbeat and positive about things. So really just being, one, aware that this is something I'm dealing with. These are my emotions. And then secondly, what you can do about it, or what you want to do about it. Sometimes people can know it and don't want to do nothing about it, which I hope that's not our audience today.
For sure. All right. And then in addition to that, I think that's the professional way. But in terms of navigating through these times as well, y'all wash your hands. All right. Y'all wash your hands. Y'all practice social distancing. Give folks 6 feet of personal space, in addition to coping with some of the psychological issues that we're forced
Absolutely.
to do. All right. So the second question that I have, what other tips? And again, you're speaking to some of these themes may be similar, but again, your insight and your input is definitely appreciated. What other tips can you give us to cope with the longevity? I think the first couple of weeks, we all were, the adrenaline was pumping. We watched containment, whatever it's called. Outbreak, contagion. We were all watching on Netflix, just kind of embracing the time. But the longer this lingers on, it's like, all right, this is getting old now. So
that's a great follow-up question.
Right. So what tips can you give us to cope with the longevity of Governor Evers' safer at home order? Is there anything that you found to be particularly helpful?
Absolutely. I think that goes really nicely with the first question, because we talked a little bit about like what my emotional reaction is. And it's kind of like, what do I do with that? Or how do I manage this as we look at this being The first 2 weeks, like, okay, I'm gonna Netflix, I'm gonna sit back, I'm gonna eat good, I'm gonna read that book, you know, but it's like, okay, I'm getting a little antsy now. It's kind of like, what do I do to make sure I'm keeping those things intact? And really what that is how you're going to treat your symptoms, in other words. You know, there's a street way, and then there's more of a clinical professional way. It's like, well, what are your triggers? What are your coping skills? So we're going to talk about, in essence, kind of how do I cope, or what I like to really call it is how do I manage my managerial skill set in regards to my emotional reaction to this situation. So oftentimes what I've found to be helpful in anyone working or managing an emotional reaction is, one, identifying what that stressor is if you can. I think for me, initially, the onset of watching the news all day, by day 3, I was like, oh, you know what? I know exactly what I need to do. I have to turn this TV off.
I know that's right.
I had to turn my notifications off on my cell phone. I had to turn my notifications off on other platforms of social media as well, because I was becoming inundated with negativity, doom and gloom. It ain't never gonna end. We all gonna get it. You gonna get it, but they not go, you know, and it was just too much. So one, limit your source of stress. If you know what's bringing on or stirring your pot, that thing we talked about in your stomach, if you know what that is and what's making that bigger, limit your access to it. Other things I would encourage is create a routine and structure. You know, everybody working from home, or a lot of us are working from home, we sleeping to the last minute before you got to flip that laptop up, you know, get up, and as my mama would say, hit the diamond, wash your face, brush your teeth, hit some other areas. Create structure and routine, because that's going to give you something to be accountable for yourself. And it's also, and more importantly, going to give you a sense of control during these times where you feel so out of control of everything else. You can create your structure, you can create your new routine, and then that gives you something to help keep holding you accountable. Other things I would suggest during this time is also finding those things that bring you natural joy and pleasure. During stressful situations, laughter does does great things for us. It releases our natural endorphins, that good, feel good dopamine, serotonin, all that stuff comes through when we laugh. So make sure we're engaging in those things as well. And then I also would say too, be mindful of what you're eating and what you're consuming. You know, if you sit up watching horror movies, or they got movies that looks like the end of times, don't sit up and watch that stuff now. You know, like, you don't need nothing else to keep giving you ideas to keep perpetuating the thoughts. You know, and a lot of things sound funny, or like, oh yeah, but
it's real.
You're not. This is what people are doing, because what you think is a behavioral therapy. There's what's the clinical term for it? Therapeutic model called cognitive behavioral therapy. All it is, in essence, is what you think is what you believe, and what you believe is what you act out. So if you're thinking on this thing all day that, oh God, this is it, the locust is coming, they putting chips in people, the virus is here, you know, you're thinking it, you're consuming it, you're watching it, you're reading it, it's here. Then it goes here to the heart. You're believing this thing, and then you will act that thing out. You will find those things. You will, in essence, go make yourself sick, unbeknownst to yourself.
Yeah.
Because when you keep in mind too, with what's one of the things that makes us susceptible to illness, weakened immune system. What weakens our immune system? Stress.
Yeah.
Lack of sleep.
Yeah, it's a revolving door.
Diet. So it's just a big circle. So if we got gaps and holes in our circle, we're just not going to get to that finish line like we want to.
That's amazing. I think that's even a scriptural principle. The Bible says, as a man thinketh in his heart, so is he.
Yes.
So if we, you know, dwell on these concepts, of eventually our life is going to act out what we dwell on and how we feel the most consistent. So again, thank you very much.
And I'll say that's what I really like about this conversation, is that a lot of people feel like science and religion cannot coexist, but they do go hand in hand. And this conversation tonight is really bridging that gap and showing people how they do go together.
One of the things that I want to transition, not to necessarily, I definitely don't want to contradict, but I think this is interesting, my next question, because you spoke a little bit about routine. And for me, I'm a routine person as well. You know, I need to do things a certain way, get up and go to work at a certain time. I kind of have a routine Monday through Friday. I know what I'm doing. I know what I'm doing on Tuesday. I know what I'm doing on Thursday.
Yeah.
And when that routine gets thrown off, that can have an impact on me.
Yeah.
So we're in a situation right now where everyone's routine more or less is now thrown off. They're not getting up and going to work every day. They're not taking their kids to school the way they're not able to stop at Starbucks like they used to, the way my wife here is accustomed to doing. But now their routine is thrown off. And unfortunately, that can have, in my opinion, you're the expert, but that can have an adverse mental health impact in terms of throwing off the routine. That's just my opinion. Is there, do you believe that there can be, again, I'm throwing this to you, any adverse mental health impact from that routine? What do you suggest now that their routine has been sort of broken up, disrupted? Absolutely.
Yeah, well, absolutely. Certainly anytime and I think we should frame some of the conversation too, for some people that maybe are joining us or aren't as well versed or, kind of new to any discussion about mental health. Everything is going to be very specific to you. So I think there are some groupings or clusters of people. Like I think Pastor Driver, you and I are very similar in that we're type A, planful, organized. I know what I'm doing. I go through my list at night before I go to bed, what I'm wearing to work, this, that, what workout I'm doing in the morning. I even know what workout clothes I'm gonna put on when I wake up in the morning.
Well, you on your own with the workout, bless God. I'm trying my best. Don't get me to get the line on here on Facebook Live. You're a little better than me, but I'm gonna get there. So you and I are very similar on 75% of it. But I'm sorry. Go on. I didn't mean to interrupt you.
That's all right. I'll take that.
Praise the Lord.
But I do think that, anytime when your structure and your routine is changed, it certainly can impact you negatively or positively. I think that's one of the things when we talk a little bit about being specific, and it's, sometimes we can do some self-reflection and saying like, hey, is this an opportunity? You don't necessarily get to choose what cards you're going to be dealt, but you get to pick how you play them. So sometimes we have to look at our perspective on things a little bit, but overall, can it have some adverse, have an adverse effect on our mental health? Absolutely. It throws off our routine. It throws off our structure. Really what it does is it causes a sense of change in us. And everybody say, oh, change is easy. Change is comfortable. But there's 5 stages of change: denial, anger, all these things. We go through a whole emotional turmoil. So for people out there that are feeling like, oh my God, I'm just like, I'm just rough around the edges. I don't know what's going on with me. I'm not anxious. I'm not fit, but it simply could just be you're enduring a lot of change at one time. And that causes us to feel some different things about it. One day you might, what, that's good. My pockets are looking better. I got an extra $25. I haven't been to Starbucks. But by day 7 or day 14, you like, look now, I need my Starbucks. I need my me time. Now, even for myself, I think I'm reflecting on like, I like dropping my kids off. Sometimes I like driving by myself in silence, or I like to turn up my music real loud and have my 3 minutes by myself in my car. So sometimes, it depends on the situation. It depends on the person, but overall, definitely this could cause some adverse effects in people. And I think we as individuals, as we navigate these times, we need to be mindful of where am I, how am I feeling, and do I need support? That's the biggest thing. Do you need support? And you're not weak, you're not bad, you're not sick, if the answer is yes.
Right.
That's good.
Speaking of children, we have 2 questions that just came in. The first is from Anna. She is asking, what do you suggest to balance work with the children at home and having them at home during school time? And then the second question, I knew these were coming up, but since we're on this subject, it's just about balance. So how do we create this balance now that our children are home full time? Helping them with their school work while we also have to do our own work. And then I think also keeping up that same routine that we're used to. So what would you suggest?
That was literally my next question. So my people that ask that, they got their pastor's heart. They got we on the same page, y'all. But I'm sorry. Go ahead and answer.
Excellent. I think that, when it comes to children and creating that routine and structure and all the balance, I think when we sit down and we factor that in, we need to also consider their schedule, what their needs are. But before we really can, as we do that, what we have to do first as parents, caregivers, is that we have to make sure that we're in a good place. Let's just be honest. I can't homeschool nobody if I ain't slept last night, if I'm irritable, if I got a short temper, I'm mad, I'm hungry. If I come with all of that, I'm going to project that on my children. So now it's no wonder your child can't focus because you can't focus. It's no wonder that they're irritable because I'm giving off irritability. So that's the very first and probably the most important thing is, as you create that structure and routine, also come in and do a self-check of am I equipped to come in here and do my best and be my best for my children today and as an employee. Other things I would recommend as we create that balance is let's just have some realistic expectations. I feel very short of this. I look, even as being a professional, I look in the mirror, I'm like, now how you go in here and do that? How you going to just mess up like that? I literally came in, I have 3 children, 2 are school age of 5th grade and 1st grade. Guys, I went in thinking I was like 5th grade APA teacher. I got my math assignments, English, we're gonna do reading, we got science. No, I can't do all that. But so we have to set reasonable expectations. The other thing I also would encourage parents to really be mindful of, and that's something again, upon reflection of my errors, is that this is also a time for our children to learn things that they typically won't learn at school. So we do a thorough dishwashing lesson at my house. You can get on the clean the bathroom up right plan. We got all day for you to get it down right now. Because you know how you save some of those things for the weekend and it's so rushed. Brother, you can do it Monday, you can do it Tuesday, you can do it Wednesday, you're gonna get it right. So also think about how can we get creative and incorporate some of those life lessons into our academic day when you're planning for your children, because let's face it, our kids go to school for 8.5 hours a day. They're not learning from the time they walk into the door until they leave. And I think a lot of us parents probably approached it thinking, oh, they got to do this. Oh, they're watching TV right now. They should be doing that, So give yourself some credit. Go in with reasonable expectations, and then also solicit the kids' feedback. If your children are old enough, ask them things they might be interested in. Anything your child is naturally interested in, that's probably something they can do with a little more independence. As we work from home, if I got a conference call, this is a perfect time for me to give you a little opportunity to go on and do something that you're a bit more independent in.
Awesome. Yeah. Thank you. I do have one follow-up question. I thank you. I think that was very helpful. I'm going to kind of ping pong this off. I have 2 professionals here. I'm very blessed on today. A professional educator, professional counselor as well. There are some parents, ultimately, again, because in the blink of an eye, they were forced to be school teachers. All right. Their kids were now quarantined with them at home. And there are some students that are that are sharp and that have all their faculties. But there are some special needs children. Oh, yeah. Can you talk a little bit? And I think I also want to hear Lady Shay's perspective on this as well. My child has special needs, and obviously I'm not a professional or licensed educator. Please help me. Please help me. I used to be able to, how do I navigate through that?
Yeah. You want to take that?
I think the most important thing is, like you said earlier, is to not set unrealistic expectations. I think as parents, we assume that because my student spends 8 hours at school during the day, they should be able to sit at home and do 8 hours worth of work, but that's not the case. They have so many other things within that day that break up that time. So I would say if you're not comfortable, because I know within the district I work in, we have a lot of parents that are not particularly able to help their students with that work either, because they might have had special needs. So I would highly recommend that they search out online resources. There are tons of them online. You have sites like Khan Academy, 10 Marks. Your district may have their own type of intervention software and programs. I would say just be patient with your child, schedule out their work. Any student that has special needs might also be dealing with some anxiety issues as well, because they might get frustrated because they cannot complete the work. So put them on a schedule, maybe give them an hour to really focus on the work, check in with them as much as possible. But I would definitely say don't inundate them with unnecessary stress by piling on the work, because you're only adding to that stressor. So I would say the biggest thing is just to be patient and set realistic expectations for them.
Yeah, I definitely would agree with that. And I think that it's also maybe helpful for parents to do that one-to-one check-in with their child too. A lot of times we know our children, but we may not be as well versed in knowing what that looks like when they're faced with that type of stressor. So we just need to be observant of those things too. If you're working with your child and maybe you'll see some regression in their behavior, maybe their sleep is off, just try to be mindful of those things. And the same things that we can do to try to take good care of ourselves are things that we can encourage or implement for our children to do too. So simple, just quiet time, rest and relaxation, mindfulness, and that can be an activity and a learning experience all within itself. Like we're going to just sit out in the backyard and we're just going to be mindful for the next 15 minutes. And what does that look like? That's where we're just quiet and we're just going to take in the things around us. So did you feel the wind blow? I felt the wind blow on my right cheek. I heard this leaf riffling in the wind, and that is a tension reducing experience, and it also can sometimes just bring down that anxiety that you may be feeling. And that's a nice way to get some sun, get out the house, get away from the schoolwork, and it breaks all that stuff up. You can come back in fresh. So just kind of be mindful of trying to employ some of those things that we're doing to stay well, to help our kids do that too.
I think brain breaks are so important. I think what you said about checking in with your child is extremely important. I think just checking in on your entire family during this time, because, and I would say I find myself guilty of this. Sometimes we all just kind of steal off to our own location and we're chilling and just relaxing, but it's so important to just check in and make sure everybody's okay mentally. And I think sometimes we do forget that. Because we're all going through this, and even understanding that children, they're dealing with this just the same way that we are. So they have their own feelings and anxieties and worries and stressors about this as well.
Absolutely.
Mm-hmm. All right. So again, thank you both for that. I think that was a very important topic to discuss because, again, all of us as parents, all of a sudden became school teachers in a matter of a blink of an eye. So those tips are definitely helpful.
Yeah,
all right.
We have another question.
Okay, sure.
Yeah. So we have another question. It says, how or what can you do to help someone who battles or deals with anxiety or depression?
Oh, wow. That's a great question. One of the things, I guess, on the first side of the question is, do know that it's not your responsibility to help someone, because that's a slippery slope. Sometimes you can see a loved one struggling. You just like, my God, this is anxiety, girl. You depressed. Come on, we gonna do something. We gonna pray, and then we gonna do X, Y, and Z. That person can totally be in a place of avoidance, or they're in denial and not want it. And I don't want someone to take on this, I have to fix it and save this person role, because sometimes people are very embarrassed, unfortunately, about having a behavioral health condition, that they will deny it and disengage, and then you begin to consume that issue or that area of concern for them. So just be mindful of that. If you are working with someone or you're concerned about someone who is receptive to your help and support, definitely I would encourage you to, one, just have a conversation about it if they're comfortable. Certainly we're not expecting for you to go in and do any kind of therapeutic type work, but just saying like, hey sis, I'm here with you. I want to support you. If there's anything I can do, let me know. Try to normalize that the conversation or what you may be experiencing. I think that's a really huge component right now, is that a lot of people, have we ever heard this many people on daytime TV talking about mental illness, anxiety, stress? I saw something, I think Whoopi Goldberg said something about like, put your pants on or something, like basically telling people, get up, get dressed, have a routine. Don't slip down that slope of you starting to feel low. So those are things that I would suggest. I also would encourage that if you are working with someone or dealing with someone who's receptive, one of the good things that's come out of COVID-19 is that it is so easy now to access a behavioral health provider. You can talk to somebody on your phone, on your couch, or on your backyard, in your backyard. So certainly there's resources available. You can call the number on the back of your insurance card. If you don't know who to call or where or how I figure that out, there's someone there that can help direct you to a behavioral health professional, so that you can just start talking about those things. And again, this doesn't make you weak. It doesn't make you crazy. And keep in mind, for many people, this will be situational. This is not a forever. Right now, in this moment, I need some additional support while I figure out how to manage and cope through this process.
Another question, it's a follow-up, and I think you already touched on some points, but I just want to make sure I address all the questions. What advice do you have for people that are mentally suffering from emotional distress?
So I think that's another one where we one, want to be mindful of how we're feeling, and then two, we want to reach out and get connected with someone that can help us manage and deal with that, with those emotions. One thing I do want to add on is, as we talk about emotional and mental distress right now, is that I think a lot of people, for a lot of people, what people are experiencing is that they have avoided something, or there's a fear base in them. That's something they haven't dealt with. So when we avoid things, guess what, boo-boo? It's you and that thing now. Ain't no this, ain't no that. There is no distraction. It is you and the thing that you haven't dealt with. So if that's fear, if that's hurt, if childhood trauma, whatever it is, when we don't deal with things, and when you get into a quiet space, those things will surface back up. Many years when I worked as an inpatient social worker, I had experienced, probably in 2 months' time, I had worked with 3 men that had childhood trauma. And it was all the consistent thing across them is that they had just retired. So their mind was idle. That thing that they had experienced almost 50 years ago came back up as if they had just encountered it yesterday. So I think a lot of people right now, when life makes you slow down, the things that you haven't dealt with is coming back up. And this is an opportunity for us to deal with it. This is not a time. You have the space. You ain't got nothing but time. Ain't nothing open but Walmart and the grocery store.
That's powerful. That's powerful. And to your point, I think that really transitions into my next question. Governor Evers shut down basically everything. Schools were closed. We're working from home now.
Yeah.
And NBA is been shut down. Stabbed me in my heart when they closed down the NBA. So everything has been shut down now, but Walmart and the liquor store.
All right. That's open.
the liquor store, LICKO, the liquor, LICKASTO, the liquor store. That is open. And talk a little bit about, because again, I know that you have significant experience regarding alcohol use. So talk a little bit about, I'm sitting at home, and to your point, everything has been rushing back, all of my childhood trauma, all the things that I've been able to escape in my routine, going to work, going to the gym, now that's closed. Everything that I've been that I've been ignoring all of my life, now I got to deal with it. And I don't want to drink it away.
Why are the liquor stores essential?
So we can talk a little bit. Right. I don't know.
That's the question that's out there.
We have our own opinions as to why the liquor stores were essential. Maybe, due to withdrawal, addiction, you don't want to
cut them off cold turkey.
Cure one problem, start another one, have everyone going through withdrawals. But for the people that don't want to turn to that, what would you say? And this is, I know we're being lighthearted, but I think this is a very serious matter.
Yeah, absolutely.
What do you say to those people that it's going to be a two-pronged question, that don't want to turn to alcohol but are tempted, but then there are also people that are recovering from alcohol addiction that don't want to fall off the wagon? I'm trying my best to stay clean and stay sober. What are some of your thoughts regarding that?
Absolutely. Great question. So glad that we're actually touched on this, because I think that is one of the topics that we don't circle back and we don't address as much as we talk about depression and anxiety, because I think that is one of the behavioral health diagnoses that is very much linked to, you're just a weak person. You need to be strong. You need to put that bottle down and put your kids first. And it doesn't work like that. When a person is addicted, and the new language is dependent. And I think that's a better description, because addicted just means I'm connected. We one and one. Dependent means I need, not want. I need to function, to breathe. Like, if nobody says you need to stop being addicted to air, no, we are dependent on air to breathe. So when we talk about individuals that are dependent on substances, that's going to create a whole lot of conversation. So first, I'll address the first part of the question. If you're at home and you're thinking about it, you're contemplating it, in the world of addiction or substance use, there's a lot of push and pull between, is it a choice or is it the dependency of it? And for this particular set, it sounds like this is a choice. There's some contemplation, there's some thought process behind this. So what I would say to people that is in that, if that's your corner where you are, The same things that we've already discussed about how do I stay in a good place, those are the things that you need to do as well. I need to get myself around positive people. I need to reduce my stress. I need to acknowledge what my triggers are. That's the language that's oftentimes used in the substance use disorder world. What are my triggers? What makes me want to use? What makes me want to get high? Stress. Some people, and from when you're working with a population of people that struggle with being dependent on on a substance, because I'm breathing. So that's you got a different set of wheelhouse and a different set of thought process behind that. So for the first half of the question, if you're thinking about it, you're struggling with some emotional issues and you just feeling low and you're like, I just want to shut all this off and just get away from this stressor, I would encourage you not to do it that way, because that just creates a slippery slope. For the second half of the question, we talk about if you are trying to maintain your sobriety. I would again encourage the same things. And I will also encourage people to go back to doing the things that they did when they were in early recovery. That was, I checked in with somebody all the time. I had supports in place. I had a routine in place, which again, we've already talked about routine and structure. So I need to modify that. I need to get into a place where I'm reading my big book. I'm doing my NA meetings. They have these resources online. You can call in for support group meetings. A lot of things have changed, but there are still some treatment programs that are open. IOP programs, support groups, all of that stuff that's using technology. The biggest thing is reach out. You reach out, somebody will be there to get you connected. And if any of our audience listening today needs support in that area, they can certainly reach out to me too. I can try to help them get connected and or stay connected with the things that has worked for them. But I am hopeful that during this time, this is an opportunity where we all can do the work. Figure out the things that pull you in, look at what those things are, and come up with a strong plan to manage it. Because if you can manage it now, you can master it. Like I already know, when people are early recovery, they've been clean for a few months and they go over to so-and-so house and just driving down the street. You don't even know how you got there. You outside the dealer's house. You just parked there. You got paid on Friday, and next thing you know, you over on somewhere you ought not be. And sometimes it's just that quick for some people. So this really is a time where you need to be connected, you need to get grounded, and you need to stay rooted in the things that have helped you get clean or stay clean.
Awesome. Although social distancing is necessary, do you foresee any lasting effects or adverse mental health impact from isolation? And what do you suggest to those individuals that may struggle after this is over?
Oh, wow, that's a good question. I definitely think that we will see some lasting adverse effects because of COVID. I would gather that the DSM-5 may actually develop new terminology around this pandemic, and we'll see an influx in behavioral health services, the need for behavioral health services. I think a lot of people are going to experience, there's different forms of trauma and PTSD. One of them is, like car accidents, or you can be in a plague or a pandemic. So I think there's going to be a lot of people that this is going to resonate with them and that they're going to need some additional support. So I think we're just going to see an increase overall in behavioral health services. But what I'm also hoping to see is that we'll see that there's this, good way to describe it, there's this normalization, if you will, around behavioral health and a need for having that service in your life. This is no different than going to a vision provider, gynecologist, or the podiatrist. This is your need, you go to the specialist. I'm not gonna go to the dentist when I stub my toe. Those two things don't make sense. So why would I go see my dentist when I'm not feeling well in my mind, or I'm not feeling well somewhere else in my body? So I'm hoping that we can see those changes. But I think overall, just this normalization of like, we're all in this together. I think we keep hearing that reoccurring message. We're in this together. We're experiencing this together. So I think a lot of people are going to feel a lot more comfortable saying, you know what, I'm not doing well. This is very hard for me. And it looks like, for me, it looked like this. For you, it may have been depression and suicidal thoughts. For someone else, they can't leave their door now because they feel like they need a hazmat suit on. So there's going to be varying degrees of this. And I think that the accessibility of behavioral health services is certainly going to change moving forward.
to your point, we actually have someone on with us that has survived COVID-19 and said that she's dealing with survivor's guilt. What advice do you have for her? What can you say to her?
That's powerful.
Yeah. That is, well, one, thanks for sharing. I think that's something that a lot of people experience when they endure a difficult situation. They feel this guilt, and sometimes it's coupled with shame and embarrassment that why me and not them? Why me? And, so and I think that's probably even more so in women, because we operate, a lot of us, from a relational theory, where it's me in comparison, or me in compared to who needs something from me. But overall, what I would suggest is that that person reach out and get connected with a therapist or provider that has an expertise in dealing with individuals that have survivor's guilt, and also individuals that have a trauma background that can help her kind of process through her experience, and then help her also understand and be able to deal and decompartmentalize the guilt that's associated with it. Because I think there's nothing more significant, particularly this is common too in individuals with substance use disorder. They have guilt and shame will keep you drunk. Guilt and shame will keep you high as a kite, because you just can't go back and say, I slipped up again, I messed up again. So people will rather stay in that low place and never get it right because they don't want to fail and trying to get it right. And that's a crazy thing to even wrap my head around. I was like, so, and I'm just as blunt when I work with people, and people that probably know me from work or other settings, they're like, yeah, she sure is. I've had some real raw conversations. I said, so you mean to tell me you rather stay on the street corner selling everything for some change than come and try? And the honest response back is, when you mess up, you don't know what my mama face looked like. I'll never forget when I let them down. That guilt, that shame, that pain. So we as people, and it's so great that we're having this conversation, we have to be mindful how we project our judgment on people. So when you encounter someone that's like, oh yeah, I've struggled with depression. Oh, you all right, girl? You crazy? What's wrong? That lean, that look.
Yeah, that's good.
You'll have a person stay wrapped up. They'll stay hurt up here the rest of their life because they don't want that like
stigma.
That stigma. Now I'm embarrassed. We'll fight hell and high water because you will not embarrass me. You will not hurt me. It's just like a child. You want your child to cut a rug up in Walmart because they want what they want. They'll put up that fight. And we as people will do the same because we don't want to be that hurt child again.
That's good.
So on the flip side of that, there's another question. What do you suggest to someone who has lost a loved one to COVID-19? So thinking about that question, what are some non-traditional ways that we can comfort those that are dealing with loss? Because we can't go to somebody and hug them or be around family. So what are some other ways that you suggest to really comfort people during this time?
Yeah, I think this is a time where we have to get back to that old school mentality where we're sending messages of love and encouragement. If you're not able to do that, that you're in prayer for somebody else. We can do that old historic thing where you actually pick up the phone and
there you go.
Do this.
There you go.
You hit 7
Come on
numbers. Now. we don't know how to hit 7 numbers. We want to hit 1,000.
Come on now.
But we have to get back to that, and we have to get connected. And sometimes the most important thing we can do for somebody right now is simply listen. Not imparting your thoughts, just simply listen. And I think also too, right now, a lot of us, and I'm a giver, I'm a doer, I like to do things, I like to stay busy. It's hard for me to sit and be still. Right. But it's also a time where it's an opportunity for me to reflect and think about how I want to give, how I want to be there, how I want to be able to be supportive for other people. And this is also a time where people can give some time in doing just that, so that if you do encounter someone that has lost a loved one, you can be creative in how you can be able to be a support to them, because not everybody needs a hug. Somebody needs $25 right now. Somebody's just trying to get some groceries.
Hello, somebody.
Somebody is trying to get trying to make ends meet. And
that's good.
If we simply really just listen, people will tell us what they need if we listen, not talking over them, not talking about, oh yeah, you saw the soaps yesterday. No, really, checking in and I'm listening from my heart.
Mm-hmm.
What you need.
Yeah.
Mm-hmm.
I think just to add on to what you were saying and then into what the question that was asked, I think from a guilt perspective, I can understand that what they call survivor's remorse and just the, I got out, and for people that have left the inner city or whatever, wherever, they have that sense of guilt, like, okay, I got out and then other people didn't. So now I feel obligated. But I think in those in those situations, it causes you just to love a bit harder.
Yeah.
And just recognize that even though you didn't have the same adverse reaction that other people have, how important now is it for you to show love to people that are in that particular situation? By no means are we better than anyone. By no means they recovered and or they didn't recover and I did. So God must love me more, or I must be more favored. We don't know the grace and we don't understand the will of God. We just have to accept it for what it is. So in those situations, I think it just behooves us to just love a bit harder and recognize it could have been you. You could have been one that had a different outcome as it relates to COVID-19 or any other situation that you've encountered and overcame versus someone else. So I think that's very important, just to know that God's grace and his will sometimes is not understandable, but it's still perfect for our life. Before we go, oh, sure, by all means. Yep.
Another question. We're gonna go back kind of to that isolation topic. Anna is asking, how do you suggest to let your children get their me or their individual time in with you in a house with multiple children?
Oh yeah.
That's good.
Oof. That's a tough one. That's a good one. I think some of the things
and you got babies too. You got babies too. Talk us through it.
I find myself giving my oldest child his one-on-one time with me while his siblings are asleep. So I let him stay up a little bit later just so that we can connect and we talk about the day, or we laugh the day, laugh in our day with a laugh. I think for my children that are a little closer in age or on the younger side, I try to incorporate something fun about their school day or their school work. And I think that it just requires us to keep having the conversation and keep pulling off of each other's creativity. I like to cook. I love to bake. I don't like my kids to eat cookies out the box. I rather bake them because I know what's really in them. So I try to do things like that. Like, well, my middle son loves to cook and they all love to eat. But if I can spend a few moments doing something just with him, and it's not necessarily about the quantity of the time, it's more so about the quality of the time.
That's
so
good.
If you don't feel like, oh, I gave her 30 minutes and I spent 45 minutes and I only did 5 minutes, it's about the quality. So if you can really connect and you can engage and you got that aha, that love moment, and that was all that you were able to get that day, it's okay. You're not going to be able to give each child the same amount of attention and time every day. And next day, maybe your other child will get a little bit more. But it's really quality over quantity in that regard.
That's good.
That's really good.
Anything else?
That was it.
All right. So what we'll do again, because I think we've spent almost an hour. So how do we, and if I wanted to stay in contact with you, not to blow up your inbox for free counseling, but I
got to eat. No, I charge.
I heard that. I heard that. But I know that, like, if one were to go on your page, you offer a lot of content. There's YouTube videos where you talk a lot about anxiety, about depression, just coping. I think this is, this is the totality of it, but I think not necessarily that, but you do this in snippets all the time. So how does one stay in contact with you?
Absolutely. So on my Facebook page, and I'm still new to all this technology because I'm old, y'all. I'm like, can you call me? Like, oh God, they didn't text me my thumb. See how fat my thumbs are, y'all? It's hard to do all that. But all jokes aside, I have a Facebook page that's geared towards mental health. It's called the Mental Health Minutes. Certainly, I keep content there. You can message me there. I have an email address there as well. My true goal in creating the Mental Health Minutes is really to reduce the stigma around mental illness. And I have a place in my heart for my community, my people that look like me, think like me, eat like me.
Sure.
So, and that's not to say that, you know, I can't be helpful or supportive to another race or culture, but it's something about, and I'll never forget working with a woman when I walked in and she said, no, I want you to stay. I was an intern at the time. And she said, oh no, baby, I want you to stay. You look like me. And the
That's
connection
good.
and the power that had. And I was like, yeah, you know, I can only imagine coming into a situation, you scared up the wazoo, and you already know how in previous years how people of color have been treated when it comes to a medical field. We're more experimental than actually treated at times. So I think for people of color to come into this thing and saying, okay, I'm going to try this thing that everybody's saying is okay for me to try, hearing it from somebody that can relate from a cultural standpoint sometimes is really important. So that was really what motivated me behind trying to get some content out here and connecting individuals in our community. So certainly like my page, my email is there. I am open and interested in reaching out to people, providing information and, you know, partnering and just keeping this conversation going, because the ultimate goal is that we get well, we be healed. We don't have to walk around half empty, you know, you all right. I don't want to be all right. I want to be great. I want to feel phenomenal. And I don't want to live a half-filled life. And I don't want other people to think that they have to. I mean, you've been there, done that, you dealt with it, you just got to keep pressing through. You can press through on a victory and not have anything holding you back and weighing you down. And we just have to believe it and do the work to get there.
That's good.
And just so everybody knows, I did tag Tarsha's Facebook page in the post, as well as her YouTube channel. So you all make sure you go on, like that page and subscribe to her YouTube channel.
Awesome. Again, I think this was very helpful when you talk about mental health in the suburban communities. You know, it's been something that's been going on for the longest. I mean, we refer to the terminology as shrink from the suburban communities, but it's been such a taboo issue in the urban communities. But as of lately, I think it's very appropriate that we start having these conversations and remove the stigma around mental health and let people know that it's okay to talk to someone. You're not weird, you're not strange, you shouldn't be ostracized, you shouldn't be casted away. You should be accepted and know that things can get better. You don't have to deal with those things all of your life. So with that being said, I can't say enough. Thank you.
Oh, thank you for having me.
You've been very helpful. I pray that those that have joined on receive some tips. Those parents turn teachers. I hope that they really hang in there. Hope they know that it's okay not to be a licensed teacher. You're not going to be perfect.
And it's okay if your baby doesn't do 8 hours of schoolwork in a day.
Right.
They should not anyway.
Right. It is okay. I hope there will, and I believe that nothing that was done here was in vain. So again, thank you so much.
Thank you. Thanks for having
I would
me.
love to connect with you on a variety of topics in the future. But I think this is a great start. And again, we appreciate your time. All right.
Awesome. Thank you so much.
You're very welcome. Thank you all for joining in. I hope we believe that it was impactful. Again, go ahead and like her page and join and peruse through there. There's a lot of good, helpful tips, a lot of good content that she shares on a regular basis that I believe will be a blessing to your life.
Make sure you also like the Perfecting Faith Church page as well.
Shameless plug, but do it. Go ahead and do it. God bless you all. Have a good night.
All right, bless everyone. Bye-bye.